Allie, Providence is Washington State's largest healthcare provider. So why, as a hospital and healthcare system, are you all concerned about climate change?
Yeah, thank you so much for that question, Lauren. You know, as one of the largest non-for-profit healthcare systems in the United States, we are both on the front lines of treating the climate crisis. So we see that truly our climate crisis is a public health crisis. So we are seeing increased respiratory illness, increased heat-related illness. At the same time, healthcare is a major contributor to the climate crisis. So few people know that the U.S. healthcare system emits about 10% of all greenhouse gas emissions in the United States. So if the gas emissions of the healthcare system were a country, it would be all of Great Britain. So I like to think about it in the names of our unofficial poet laureate in the United States, Taylor Swift. Hi, I'm the problem, it's me when it comes to healthcare.
You mentioned how climate change is disproportionately impacting vulnerable populations. How are you seeing that affect the healthcare space, and what are you trying to do about it?
Unfortunately, systemic inequities are everywhere. When it comes to our climate crisis, those who contribute the least to climate change are impacted the most. So, for example, in 2021, we had an extreme heat dome in the Pacific Northwest where we had several consecutive days over 100 degrees. And our infrastructure is not equipped to handle that. So we had issues with continuing our operations within the hospitals. But tragically, there were about 1,400 people who died due to heat-related illnesses, and those were preventable deaths. And those who suffered the most were those who didn't have resources or access to cooling centers, air conditioning. So truly, the most poor and vulnerable are disproportionately impacted. For us at Providence, one of our core values is justice. So we see this as a justice issue and as part of our efforts to advance health equity.
And is there guys, clap for that, please. How can you help those populations? Is there information that you have? Is there access? What can you as a healthcare system do?
Well, we're working on addressing our own problem and our responsibility. So at Providence, since we established our goal to work to become carbon negative by 2030, we now have 89 sites operating on 100% renewable energy. We are also addressing the extreme amount of waste that hospital systems create. It takes a lot of energy to run hospital systems, but waste is kind of a sleeper issue. So just across the Providence system, we generate 100 million pounds of waste a year. And before we started on this journey, much of that waste goes to landfills. Where are landfills located? Disproportionately in low income and community of color. So we are working on our waste optimization. Several of our sites, we've been able to reduce waste by 50%. So we're going to continue that journey. But we also can't do it alone. We need to reach into our communities and partner with them. One of the things that we've done is we have a program that outlines vulnerabilities of individuals when it comes to heat-related extreme weather events. Who is most susceptible? We are able to identify those individuals in the electronic medical record, and when there is an extreme weather event, we can go into the community, contact those individuals, reach out to them, provide them with the resources that they're not able to secure themselves, so air conditioning, air filtration systems, take them to a cooling center. So we are working both within the walls of our hospitals and then outside of the walls to partner with the community to help those who are disproportionately impacted.
You mentioned the heat dome. We've had hot temperatures this week. We've seen hurricanes. How are you thinking about the increased impact of natural disasters? How do you make sure that your providers are prepared for that, your facilities are going to be able to withstand it when people are going to need your help the most?
Climate resiliency for the healthcare system is a major issue. We were very proud at Providence to be the first healthcare organization to sign on to the HHS and White House Climate Pledge. Part of that pledge was the creation of a resiliency plan. So we just completed our resiliency plan for 51 hospitals to ensure that we can continue to serve our communities and also continue that outreach into the communities in the face of these extreme weather events.
And what makes you most excited about the change and the ability that you can affect in the climate space?
I think what makes me most excited is partnerships, like with all of the leaders in this room, the work and the awareness that Bloomberg is bringing to this issue. And I think while this is a challenge for healthcare, it's also our biggest opportunity. We have an opportunity to advance climate justice, advance health equity, and eliminate health disparities. So for me, that's what gets me up every day, and I couldn't be more proud that Providence is leading the way in this.
Amazing. Thank you so much, Allie.
Thank you.
Thank you all.